We also still have the post-marketing surveillance, so whenever vaccines or medications are released, any sort of adverse event that happens after the vaccination, whether it's related or not, gets submitted to your national monitoring agencies, and all the countries around the world do it, and then they pull all the data together, and everybody goes through the records and says, was this rash or headache or death or anything related to the vaccine, and there's, with billions of doses given, that's a huge pull to then look for adverse reactions that are rare or might not have happened in the trial. We were looking at the data earlier today, and there's been no deaths recorded in New Zealand that look like they're related to the vaccine. There's been hundreds of millions of doses given the US, and they've had not a single death that looks like it's related to the vaccine at all. So all those kind of things that might be too rare to show up in a trial would show up in those billions of doses. So that's ongoing as well.
Yeah, and I think it's important to compare that data with the data around survival rates and the sickness if you get COVID, and really that's the balance, is how likely am I to get sick from the vaccination or have an adverse reaction versus if I got COVID, what the outcome would be. And I think that data is quite frightening rather than the vaccination data. I think the COVID data is really frightening, and particularly for Māori, when you look at it as a proportion of population, Māori have the highest rate of requiring intensive care and hospitalisation. When they've gotten COVID, the mortality rate is higher. Proportion of, even though we haven't had many cases, proportion of population, that how we fared with COVID hasn't been so great, and that's frightening.
And that's probably the harder thing again with being in New Zealand, is we haven't seen a lot of it, so that really experiencing that, what is the difference between the vaccine or having COVID, we've got no direct experience of that, and always have to still look over, outside of the country really to get that sort of bigger picture.
And I guess the other thing to add on to that disease and like the risk of something bad happening if you get COVID is it's not just to you, it's the risk of you giving it to somebody else who's more vulnerable, or babies or young people who can't be vaccinated.